Thank you very much, Thandi. I am very glad to hear that this is being studied by the SAMRC. We experience the heat, and everybody knows that it's becoming unbearable. But the poorest of the poor are not being seen in this space. We hear a lot of news overseas about, people fainting in Europe from heat waves. And occasionally an elderly person will die from it. But we really have had very little attention paid in South Africa about our very real problems. I mean, sitting at a clinic for 9 hours in an overheated indoor space is just,
Mm. It's very worrying.
it's very worrying. It is against human rights. There are some injustices that are happening here all over the country. There are some questions. Let me see in the chat. Pomutso says, I would like to find out if the use of cool seal surfaces have been explored in South Africa to mitigate the urban heat island within the cities. You said that some reflective heat paint has been tried, but has that been tried in South Africa?
So that was cool seal.
Cool seal surfaces.
Okay, that's really interesting. No, not that I know of. So maybe that's a potential research idea for whoever shared the message in the chats.
That would be fantastic if you could try that out. Then Anonymous says rising temperatures can also lead to activation of dormant microbial spores, thereby posing risks of disease outbreaks, so-called
Mhm.
disease X. How is the country preparing in this space?
It just could you repeat the question so I can write it down?
Oh, sure. Rising temperatures can also lead to activation of dormant microbial spores, thereby posing risks of disease outbreaks, so-called disease X, right? By which I assume that the questioner asks, what will be the new disease that will emerge,
Mhm.
and how is South Africa preparing for this?
So I do think that we need, like I was saying now, we need more evidence around this sort of thing to show the risks and the potential impacts as the climate changes. I don't really do a lot of work in the sort of microbial space, so I'm really not well placed to respond to that. I'm sorry.
Okay, no problem. I think that it's an important area to research, and it's obviously not your area of research. Then I want to ask, what is the difference between the temperature and the apparent temperature?
So apparent temperature is generally usually higher than normal temperature. And this is because apparent temperature takes into account other measures like humidity and wind speed. And so once you factor in all of those temperatures, the way that the body experiences the temperature is generally higher than what is just the normal temperature.
Oh, I
So
see.
generally apparent temperature is usually higher than normal temperature.
Okay, right. And are all these settings where you've done measurements, are those areas that have high humidity?
Yes, some of them. So, for instance, in Accra, that's a coastal town, so that has very high humidity levels. And as well as, but obviously Limpopo is a lot more inland. So that's not the humidity there is not as high as coastal towns. The Khayelitsha site is also not as humid as Accra. So no, so we measured, we work in a variety of climates, not just high humidity climates.
Right. Very interesting. Uh, are there, are there some outcomes thus far? Did the reflective roof paint, was there an indication that it made a difference?
Yes, so we do have anecdotal evidence, and we also have some plots as well, but I didn't include those where we show the difference. There's a significant drop in indoor temperatures pre-intervention as well as post-intervention. We're also now conducting a number of discussions with our communities, sort of focus group discussions to understand how they perceive this change, because we can see it, of course, in the evidence, but it's also important to understand from their perspective if they feel that it's making a difference. And so far, we're getting very positive feedback. People do feel that, the summer was a lot more bearable with the intervention.
Okay. Oh, that is hopeful. A very interesting and very important area of research. Yes, S. Mabida.
Hey, how are you? How are you?
Hi, fine and you?
Thank you, thank you. Thank you, Thandi, for the nice presentation. And also, I like the topic. And also, I've seen that you've done the work in terms of high temperatures, in the heat temperature, especially in Khayelitsha.
Mhm.
Yeah, so I just want to know that have you guys look at the impact of these heat temperature in relation to cardiovascular health conditions and or complications? Because now there is this systematic review that that has recently published. I think I've attached the DO number on the
Mhm.
on the charts in a non-communicable disease unit. So
Yes,
which
yes.
was touching at the extreme temperatures exposure and cardiovascular
Mhm.
disease. It was a systematic review, but have you guys have
Yes.
considered to look at the outcomes of
Mhm.
these exposure to in relation to cardiovascular complications? Thank you very much.
Yes, thank you for your question. Yes, so that is a really important health outcome in terms of heat exposure is cardiovascular health outcomes. So we have looked at it, but only from a point of in terms of mortality caused by cardiovascular uh, diseases. And we did find that there was a higher increase or a higher rate of mortality during events, during high heat events. But of course, we do nationally as a country need actually more cohort studies that will gather the information so we can specifically link not just to mortality, because that's the only sort of national health data set that we have, but we need sort of more localized studies that will collect data on the health impacts linked to cardiovascular health outcomes. So I'm not aware of any that are on the go now, but there might be. But I think, yeah, that is a very important area of research that we certainly still do need a lot more evidence on.
Thank you
Yes.
very much. That would be great.
Thank you very much for that question and for the link that you posted in the chat. I've found the link and I see it says systematic review assessing the association between extreme temperature exposure and cardiovascular health outcomes in Africa. So that sounds very interesting indeed. And you're one of the authors. Zichle, is it? Environmental
No,
research.
no, that's not me.
Is that not you? Oh, related.
Thank you, guys.
But thank you for sharing that article.
Thank you.
Question for Thandi. This is from Mariam Rumani. What would you deem the top 4 priority areas for climate and health?
The top 4 priority areas, I would say the first would be child health. I think we do need a lot more evidence to show the health impacts of extreme heat, in particular on children. I do think we need a lot more in terms of policy, in terms of heat action plans focused on, early childhood development centers, schools, and that sort of thing. So I think for me, the top priority would be child health in relation to climate change. I also think a focus on rural populations in terms of exposure to climate change. I do feel that, because of various underlying resources, they are already vulnerable to a number of things. And when you add climate change as a stressor, you are just, this is just a waiting, a ticking time bomb. So I also do think a priority should be a focus on vulnerable populations. Another top priority, I think, is the investment in research looking at longitudinal cohort studies, because the only way we are going to gather the evidence that we need to be able to, to inform policy, to make the case of the severity of the impacts of climate change on health. It's not just some abstract thing. It's, it's happening now. And so I think to show that we need more investment into research and not just, the usual cross-sectional research. We need long-running longitudinal cohort studies. Like I think it was Sihle who was talking about cardiovascular health outcomes. That's all evidence that we're lacking. And those things all cost money. If you're going to be monitoring several cardiovascular health outcomes, those tests are expensive. And so I think investment into research, longitudinal cohort research really is a pressing issue. Another thing also I think is the impact of climate change on environmental pollutants as well. I do think that's another thing that tends to sort of, be neglected a little bit. So for instance, we know that climate change does impact the availability of heavy metals in water, for instance, groundwater. And we know that in many parts of the country, people are reliant on groundwater due to the lack of access to water. And so as the climate changes, this then impacts the safety of that water, thus impacting their health. And I think that's also really an area of priority.
Wow. Thank you. Thank you for that question and for the answer, which you obviously had ready, Thandi. It is that gives one a very clear idea of where we are lacking and what needs to be done. In that relation, I also wanted to ask you about the availability of data, because I think that there's a lack of data in the public health system as a whole. And so the data of how long patients are waiting and the effects on them, I would imagine that we don't have access to that yet, that it hasn't been gathered.
Not readily, no. I mean, I think that's a common problem in many low middle income countries is sort of health data, the access to health data. Another problem in many parts of the continent is that, many records, hospital records are hard copy. We've had the same when we work in the more rural areas. We have to digitize hospital records, and then we look at the associations between the health burden and climate. We've looked at, air pollution, we've looked at temperature, but that's obviously a very time-consuming and expensive exercise if you have to go and digitize all of these records. So yes, the availability of health data really is limiting our progress towards understanding the impacts of climate change on health.
Right. And then obviously it's delaying the ability of the state to address those problems and everyone else.
Yes.
Nadaraj Govender says the study has very interesting recommendations even for current practice. As I've been to Home Affairs in KZN, crowded rooms, high temperature, etc. Are there people out there in departments aware of the issue? No toilets and drinking water too. Yeah, so this applies to the health system, but also to other government departments like Home Affairs.
Yeah, I mean, that's also if you're exposed to this hot environment, one of the things we tell people is when it's hot, stay hydrated. But if you have no access to water to stay hydrated, that's really, it's a big problem.
Yes. Thank you very much indeed, Thandi. It's not good news that you've brought us, but it's very necessary that these studies are being done and that this data is being collected. Thanks very much indeed.
Thank you so much.